Introduction to restorative care. This resident is a stroke victim. He is performing range of motion and stretching exercises under the guidance of his RNA. Restorative nursing interventions such as these have helped him improve his overall mobility. As a result, he's been able to perform many of his ADLs more independently. The goal of restorative nursing is to improve or maintain an individual's highest level of functioning possible. This includes promoting independence and encouraging residents to participate in their own care.
It's helping them keep being able to feed themselves, keeping them mobile. If they come in continent, it's being able to keep them that way, keeping them independent so they feel like they're still involved with the day-to-day living of their lives, that everything's not taken out of their hands.
The MDS 3.0 defines restorative care in the following way. Restorative nursing program refers to nursing interventions that promote the resident's ability to adapt and adjust to living as independently and safely as possible. This concept actively focuses on achieving and maintaining optimal physical, mental, and psychosocial functioning. RNAs are the frontline caregivers that provide the majority of restorative nursing. They work under the supervision of a restorative care program coordinator who is a registered or licensed nurse. The coordinator supervises program activities such as resident assessment and screenings, care planning and setting goals, documentation, scheduling and assignments, and training. An important part of a coordinator's job is to identify residents that can benefit from restorative nursing and get them started on a program. Individuals that qualify typically have one or more of the following conditions: history of falls, indwelling catheter, contractures or the risk of developing contractures, incontinent and lacking a toileting plan, difficulty with activities of daily living, inadequate food and fluid intake, or unplanned weight loss.
My role is, well, we're going to get you back. Now you're going to do this. We're going to get there just one day at a time. And you have to keep being that one to push them. Come on, you can do this, you can do it. And then they realize, didn't think I could do this, and now I'm able to do this. And they feel good about it.
The restorative care team often works with skilled therapists as well in addressing the needs of residents. They include physical therapists, occupational therapists, and speech and language therapists. A skilled therapist may be requested by the coordinator to screen or assess a resident. For example, there may be an individual having difficulty chewing or swallowing, or a resident that has begun having trouble with mobility. The purpose is to assess the individual and start a treatment plan.
Then we'll write up what we think they need, whether it be exercises or splinting schedule or range of motion or a stretching schedule. And we write that up on a form, write out what we need, how many days a week, and then we send that to restorative.
It is important to note that many individuals also enter restorative care after receiving skilled therapy. These residents may have experienced a decline in functioning due to stroke, certain disease conditions, illness, injury, or surgery. The goal of restorative nursing is to maintain or possibly improve upon the gains that a person has made in skilled therapy.
We really like to see them maintain the level that they've achieved in therapy. We don't want to discharge them and have them go and sit in their room and 6 months down the road, oh, Mr. So-and-so was walking 100 feet down the hall, but now he can't even get up and walk to the bathroom. Well, why is that? Well, because he sits in his chair all day. And so anything that they can keep doing by themselves is a huge achievement for them.
With restorative, we pick up and we extend that care because there are so many of them that need it. Some of them for just a little while. Some of them need maintenance for, long term.
The MDS 3.0 provides a listing of standard restorative care practices that RNAs should be able to perform. The goal of these practices is to help maximize a person's functioning. There are two basic categories: technique and training and skill practice. Technique includes passive or active range of motion and splint or brace assistance. Training and skill practice includes bed mobility, transfer, walking, dressing and or grooming, eating and or swallowing, amputation, prosthesis care, and communication. These restorative care practices can help individuals improve or maintain their ability to perform activities of daily living. For others, it can prevent a decline in functioning or slow its progression.
You know, we've gotten them from where they are bedbound to where they are up, getting out of their bed by themselves and using walkers to go to and from the restroom. And to me, in just a short amount of time, I thought that was, pretty amazing.
In general, the goal of restorative nursing practices include promote mobility, increase muscle strength and balance, prevent contractures, prevent skin breakdown, prevent undesirable weight loss, and promote continence. Restorative care is often a journey of small steps. No matter how small, it can still be a step forward.
If you can't pick up your arm, you can't even feed yourself. And if I can get you where you can feed yourself, that's an accomplishment.
Helping residents to function more independently requires gentle guidance and encouragement. It calls for praising individuals for their effort.
Let's do better. Let's go a little bit further today. Because I want you to do better. To be more independent for yourself. You can get beyond where you are. You don't have to be in the bed. You can be up in a chair.
The loss of functioning and independence can result in feelings of hopelessness and may lead to depression. Research indicates that nursing home residents suffering from depression are at higher risk for falls, illness, and undesirable weight loss. However, residents that improve functioning develop a greater sense of well-being and dignity.
If I can just get them where they can walk to the bathroom, that's a major step for them, because it gives them back that part of their dignity.
So I encourage them to keep going forward. Even if you don't feel like it, just do it anyway, because it makes you feel better at the end of the day.
It means that you can do it. I mean, there is hope for another day.
There's several, people that come to mind. I mean, I had like one very, very sweet little old lady, stroke patient, when she came to us, she couldn't do anything. She was just a whole log in that bed. She couldn't turn. She wouldn't do anything. And a lot of these patients, she was depressed. She was upset. And then, after talking to her, cheering her up, letting her know, hey, come on, work with us. We're going to work with you. We're going to get you better. And, it wasn't even, it was before the 90 days was even up. We had her to where she was getting up and going to and from the restroom by herself. All she needed was just a little supervision.
Restorative nursing is an important part of a facility's duty to assist residents in reaching their highest level of functioning possible. It can provide benefits such as these: improve quality of life for residents, enable a resident to function more independently, reduce the level of care a person needs. This can help make the nursing staff workload more manageable, improve a facility's quality indicators and quality measures in areas such as weight loss, pressure ulcers, incontinence, and falls. Finally, a restorative care program can increase a facility's revenue. Unlike routine caregiving, restorative care is reimbursable. However, the facility's program must meet CMS's guidelines for what qualifies as restorative services. This includes correct MDS coding and all associated documentation. This facility recently started a restorative care program. The benefits have been significant.
We don't have the range of motion problems, the in-house acquired contractures that we had before. Also, when you do your fall reports every month, since we've had a restorative program, looking at it from 1 year to the year before and looking at it from a long-range data, you have less falls.
We have less incontinence. We have more people on scheduled collection. We have less weight loss.
You see the excitement of the families when you have your care plan meeting and a family member comes in and says, I can't believe y'all are doing this. Thank you so much. I've been wanting Mama to get these exercises. I've been wanting her to be able to do this. I knew she could.
We often find in homes that do not have restorative care programs, those residents end right back on therapy. And it's the same vicious cycle. They might be gone a month or two, and then they're right back on your caseload, and you're addressing the exact same issue that you were before. And with restorative care, that declines dramatically.
A successful restorative care program requires that team members understand one another's roles and duties. It requires open communication and mutual respect.
And it takes getting everybody to be on board. So you need to make them own the program. You need to show it to them, explain to them how it's going to benefit the staff, how it's going to benefit the residents who we all have their best interest at heart. And when you get them on board, they'll see how simple it really is to run, and that'll determine your success.
The care that RNAs provide can be life-changing. Their guidance and support is essential for helping individuals face their fears and the challenges before them.
I don't like seeing people in that dark place, especially if I feel there's hope to come out. And with a lot of them, a lot of them, it's there. The hope is there. They can do it. They just need someone to, open the door and just kind of like not push them, but just tilt them a little bit to go on.
For your post-test, you should be able to list some of the basic goals of restorative care. Describe the duties of a restorative care program coordinator. Give examples of restorative care practices performed by an RNA. Give examples of causes that may result in a loss or decline in functioning. Give examples of residents who may qualify for restorative care. And describe some of the main benefits of a restorative care program.